SHEM Ministries, souls honoring Elohim's mandate. And now for today's message.
Hello, hello, hello. Welcome, Shemites. Shemites, yes. Those that follow SHEM Ministries. You are Shemites. Souls honoring Elohim's mandate. And tonight is our SHEM 2 night. That is a spiritual, healthy, enlightening mandate ministry. And I am Dr. Anna Shaw Devlin. So tonight, we are going to talk about something that kind of Pastor touched on last night. Those of you who were with us on last night, he talked about hate. And even though why do you hate me? And I think he kind of wanted to go toward relationships, spiritual relationships, like we talked about sin. Let me say this. We talked about a lot of stuff, okay? But out of his message on last night, I'm not going to go back and try to say what, because I don't think he's complete or finished with that message. So we're going to leave that alone. But other than the fact of saying on last night, we had a conversation about sin, and we somehow talked about hatred. And we talked about the KKK. So you can pull so much out of that. And as I was sitting there, the Lord was dealing with me about race. And because I made, some statements about, challenges. I have made statements in the past about challenges that African Americans face in healthcare. And long story short, we're always below and not above. When it comes down to how we rank, how we, the risk factors are always higher for us, and we don't have the this and the that. Well, we're going to address that tonight, okay? And I'm going to talk about where a lot of this stuff stems from. As this ministry is all about educating God's people. And we are destroyed for a lack of knowledge. And I've always focused on lack of knowledge from us, not knowing the healthcare system, not knowing how things work in healthcare. Well, okay, let me just pump my brakes and let me pray, because I'm getting kind of fired up. Okay, we talked on last night about hatred being driven by when you are intense and passionate about something. Well, guess what? I am really passionate and very, very intense or tense. I can get intensified when I talk about what I'm getting ready to talk about, because it really sets me on fire. So let me pray first. Dear Heavenly Father, we give you all the honor, the glory, the thanks, and the praise. Father, we thank you, oh God, for this day, Lord. Thank you for allowing me, oh God, to be able to live another day to work for you in your vineyard. And your vineyard, Lord, is even in a bush, even in weeds. Your vineyard is anywhere we have to go, or we could be broke down on the side of the road, and the person who stops to help us, God, you can speak through us to them. Father, we could be standing in line waiting on whatever, and the person in front of us or behind us may need to hear from you. So my God, I thank you for counting us worthy to still be in the land of the living, and oh God, allowing us to take every opportunity to minister to your people. Now, Father, as my flesh dies right now, in the name of Jesus, speak to your people as only you can. In Jesus' name we pray, amen. All right, now, I was getting kind of worked up there. I'm getting kind of passionate about this thing. So this is where I want to go. As a healthcare provider, I kind of want to say, well, anyway, did I tell you the topic? The topic for tonight is preparing for the race. And I'm speaking about a race, but I'm talking about preparing for us as a race of people. We need to educate the people who are trying to educate us about how to take care of us. That's why I said tonight, it's going to be a little different. I am always trying to tell you the things that you need to do to better take care of yourself. Now I'm going to flip, and I want to talk about the myths about Black people. Because I really think if you know the myths that are out there, then you can kind of put them to bed and say, I know that they say blah, 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 but that's not true. Because guess what? When a person goes to medical school or they go to school to become a healthcare provider, that's not part of the curriculum. The socioeconomical, so now we talk about social determinants of health. It's everywhere. And the social, let me tell you what are social determinants of health. And this is what is out there that people utilize to say the reasons why we lag behind other races. I say we, meaning Black people, African American people, not just Black African Americans, but Black and brown people. We're behind other races, such as the Caucasian race, when it comes to certain things in healthcare. I believe, and we're going to address this, that a lot of those things, when we talked last night about hatred and how hatred comes about, where a lot of it is things that you were taught that are not true, and you learn to hate something or someone that you don't even really know only because of the color of their skin. That was part of the conversation last night that precipitated this conversation that we're going to have tonight. So if you were taught that all Black people, blah, 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 pertaining to their health, for example, pain, they don't feel pain like everybody else. Who said that? Who told you that? These are documented myths about black people that are not true. Do you know why they may say we don't feel pain like other people? You want us to go back to slavery? Huh? Let's go back to slavery. First of all, we are a strong-willed people. Strong-minded. Okay, we are. And it's something that anyone can do. I think that there's just certain things in our DNA makeup that is there. You do or die. But how do we get there? Because first of all, if you think about those of us that are African American, that our ancestors made it across the ocean in a ship, chained together like livestock. The people that survived, only the strong survived. So our great whatever that is in our DNA were strong people to just survive that journey. So we already have that strength in our DNA makeup, okay? We also developed a way of tolerating what we had to do to survive. For example, you're a slave out there in the field. You know that if you did not pick X amount of cotton, you were going to get beat or you may not get fed. So you learned how to endure. You gained strength from what you had to do to live. So that same strength that came from your ancestors on the boat that survived slavery, survived the whippings, survived your family being torn from you, and you still lived, that same strong person lives in us today. Okay? So because you don't cry, they think you don't hurt, but we learned how to be tough. Don't you know that if someone sees you crying, that's a sign of weakness, and they will keep tormenting you because they know that's how to keep you in line? So we could not let it be known how bad things bothered us if we wanted to survive. Yeah, you get where I'm going with this. So that same mentality that was required of us to survive is the same thing that keeps us surviving today. And the same thing that the massa used to break us down, that survived time too. So now we're in this race of life, maintaining your life, health, and strength. We're in a race where we have to be smart enough to understand what it takes for us to stay healthy. And part of that is figuring out how these social determinants of health affect us to still be unhealthy when all the knowledge and understanding and the ability to be educated is there. So what is the issue? What is the problem? I say providers need to be educated on these things that we're going to talk about tonight. We need to, in preparation for the race, for us, our race, we need to know what myths are there, and we need to put them, squash them. That's only a myth. So I'm going to talk to you tonight about myths about Black people that have hurt us more than helped us. Okay? But first of all, we're going to go over what social determinants of health are, because this is the educated man's hospital environment way of understanding. This is their reasoning why we are no better. We're not doing as well as we need to be. This is what the Center for Disease Control is saying. Now, I'm not saying that this stuff is not true. I'm just saying that there is a layer of myths underneath these social determinants that need to be dispelled, and we need to dissolve them, and we need to get rid of them, because what's under these determinants, social determinants, is actually what's the root of what's killing us. Okay, so social determinants of health are the non-medical factors that influence health outcomes. So we're battling making sure the medical part, and that's what I've been teaching you. The things medically that you need to know that's going to make a difference in how healthy you are. But the non-medical stuff are these social determinants. They are the conditions in which people are born. Okay, well, you're born in a certain condition, and you can change the trajectory of your life. For example, that's what my family did. That's what my mom did. She took advantage of getting an education because she knew that getting an education would get her and her family out of the environment that she was born in. Okay? These are conditions in which we grow. Okay? We work, we live and age, and the wider set of forces and systems shaping the conditions of daily life, such as, Medicare and who's eligible for this, and food deserts, and, having access to health care, all of that stuff. These forces, now it's going to break it down. Okay, I should have kept reading. These forces and systems include economic policies. Right, who can get what? Who can qualify for student loans? Pell Grants. Well, if you ever went to jail and was a felon, what about the person who was falsely incriminated? What about the before they had the DNA, the capability of testing this, and what about all of that? And you're labeled as a felon. I didn't even realize that being an accessory, you're a felon. So you don't qualify for any government benefits. So you're already in a bad way, right? I'm not even going to get into the legalities of plea bargains. Don't go there. Don't go there. Okay, I'm not going to go there. Okay. There's the development agenda, social norms, social policies, racism, of course, right? That's what we're talking about tonight. Climate change and political systems. These are all social determinants of health. So we're focusing tonight on the race as a social determinant of health and the myths about Black people. Okay. All right. So I just wanted to explain that to you. And I have talked to you in the past about the social determinants of health are one of 3 priority areas for Healthy People 2030. I talked about these are guidelines. These are goals that we want to meet in changing things. Along with health equity and health literacy. So the access to health care and literacy is where I focus the most on. This is my passion. This is the thing that drives me is health literacy. Making sure that you understand what your doctor is telling you. Okay? That's my passion. So I'm going to leave that alone, but I just wanted to at least explain to you that what these social determinants were so that you would understand. We're going to break social determinants down into race, and we're going to focus on race. And the health literacy is the part of race, and health literacy is telling you the 5 dangerous medical myths that hurt Black people. Okay? I hope this is really going to make sense to you. So in preparing for the race, we need to educate our healthcare providers and people who come in contact with us. And that is one reason why most of us, let the truth be told, okay, gravitate toward healthcare providers that look like us so they understand us. And look, when a Hispanic who only speaks Spanish or doesn't speak English well, they gravitate towards, because don't sit there and act like if a person, you got to know their culture, and language is major. You got to be able to communicate. You have to know what that word means to them in order to get a clear understanding yourself. So, okay. And so race is, one thing I need you to know first, race is a social construct, not a medical condition. What am I talking about? What is a social construct? Where's my paper? I had an actual definition of what a social construct was that I wanted to read. I didn't want it to come from me. I wanted it to, here it is, I found it. I wanted it to be not my interpretation of what social construct was. So a social construct is a concept that exists, not in objective reality. So when something is either subjective or it's objective, subject is what we say or what we see or whatever, and objective is factual. You can prove it. It's objective. And it's objective reality. So you can sit there all day long and interpret something the way you want to interpret it. That's subjective reality. That's your realization of it, how you feel about it. But objective is proven. It's real. Okay? So a social construct is a concept that exists not in objective reality, but as a result of human interactions. Okay? So you see how I act and you, or how I may, and you, okay, let me do this. I can be in a grocery store and cut up with people, right? And you may make an assumption of me based on that human interaction. You don't know I'm Dr. Anna Shaw Devlin. You don't know what I do for a living because I'm just cutting up, right? Okay. So, and it's and actually these human interactions exist because humans agree that it exists. So for example, you see a kid doing something and you make an assumption that, well, let me break it down a little bit farther. You see a black boy walking down the road with dreadlocks, and I hope his pants ain't sagging, but he may be young and ain't figured it out yet. So you assume where he is from and who his parents are just based on what you see. And then everybody with you makes the same assumption because you agree that, oh yeah, gotta be. Oh yeah, he has to be, But that is a social construct. That is something that it's a concept. It's something that just exists because you just, felt that had to be that way. So race is a social construct. You assume things about people based on their race. It's not a medical condition. So you can't take that. Okay, let me keep going because it's going to make sense when I go through all these myths. Okay, so there is a lot of experiences and things that Black people have had. And we talked about in Black History Month, remember when I talked about the medical apartheid and things that were done to Black people. I mean, these are documented stuff now. Testing that they did on Black women without, OBGYN stuff, without anesthesia. Because remember the myth, Black people don't need anesthesia or don't hurt, they can handle it. Okay. So anyway, and so Black people deal with racism in everyday life, even when it comes to health. Okay, this is the article that we're reading right now, and it's from 2020. Okay, it was September 30th of 2020, and it's Race in Medicine: 5 Dangerous Medical Myths That Hurt Black People. It is important to understand the distinctions between 2 facts. The first is that race is not biological. Race is often confused with ethnicity, when the two are not the same. Race is actually a social construct, and that's what I just got through trying to say. The second is that Black people have particular experiences regarding health due to those social determinants I just mentioned, like lack of access to health care, education, and generational wealth. Okay. But if you really, really think about why that is, this is caused by racial injustice, not race. Racial injustice, the 40 acres and a mule that we didn't get. that would have helped us to have some generational wealth. But when you are tricked out of things, because first of all, you can't read and write, I'll leave it alone. All right, conflating these facts leads to myths that prevent Black people from receiving appropriate care. Myths need to be exposed. Now let's start with, let's just talk about COVID-19. COVID-19 has exposed and worsened issues of health inequity and the danger of myths about Black patients. At the start of the pandemic, misinformation, that's right, and memes circulated that Black people were immune to COVID-19. So much mess out there. Like sickle cell, the anyway. I'm trying not to get caught up in my all right, let me keep going. This was quickly recognized as dangerous and rooted in a long history of systemic racism within the medical field. They squashed that and shut that down. That is not true. Get it out there. People, pastors, educating their congregation. That's not true. That's not true. Get the word out. Pass the word. Pastor, please teach your people that are seeing all this stuff on social media that's not true. So when you had a lot of Black people not wanting to get vaccinated, not wanting to wear, anyway. Okay, so I'm going to move on. In 1792, these are exposing myths now. In 1792, there was a yellow fever outbreak. And it was thought that it happened again with smallpox in 1870, which was thought to have no impact on Black people. Racist ideology and othering of Black people made these myths easy for a white public to swallow and made it easy for medical professionals to believe that Black people felt less pain than white. Okay, we are talking, yeah, but it's in here. Then there was the now infamous Tuskegee syphilis study, which ran from 1932 to 1972, 40 years, and caused the death of Black men who were intentionally left without treatment. These men were robbed of the opportunity for informed consent and were essentially led to believe they were receiving treatment when they were not. This is one of many examples of doctors treating Black people as fodder for experimentation in the name of science, rather than as real human beings. Remember Black apartheid? If you want to, please go back and view that segment. These incidents and others like them led to the erosion of trust toward medical professionals in the Black community, which has impacted their access to care. So I guess what I'm trying to say is some of our social determinants and some of why we lag behind, a lot of them were rooted in hatred. Okay? I just made a statement that I'm getting ready to back up because I need you to understand. This is what I realize about people. hatred, or maybe I shouldn't, hatred may be a harsh word, but I believe that there's certain levels of dislike that lead to hatred. Let me say that. And it's based on what you were taught. And there were many people, hatred is taught. Have you ever seen that picture where there's this little black kid and a little white kid and they were playing together and they're best friends? I mean, best buds. Didn't even know that there was a difference between the two of them at all. They were just having fun. Until one of the parents said, "You can't play with them." That's what I mean. Now, hatred is a hard word, but what I'm trying to say to you is it bred from something. It bred from the rules. You can't go to their house. You can't eat their food. You have to walk in the back door. They can't come in our front door. You can be friends with them at school, but you can't bring them home. You can be friends, but you can't marry. You can dance on the dance floor together, but you can't be intimate. Rules. When you walk into, keep your eyes down. You can't look them in the eye. Come on now. Some of that stuff that was taught. Don't make me talk about Emmett Till. But that is how racism and the hatred I believe is still rooted through some of these myths, or tangled up in some of these myths, hidden. And people don't even realize it until they're called out on it. Oh my God, really? I didn't know that was my white, I was thinking I had white privilege. I didn't know that's white privilege. I didn't even know white privilege exists until you tell them. Okay? All right. So, anyway, we were talking about the Tuskegee syphilis study. And trust. Things such as that study is why a lot of people just I don't trust the doctors. And then there are some people who trust everything the doctor says. So, as a result of this, among other factors, HIV had disproportional effect on Black communities in the 1980s. Yeah. In 2020, as COVID-19 cases in Black people increased, the original myth that they're immune flipped. Instead, the idea that Black people are predisposed to COVID-19 started to gain traction. It suggested that higher cases in Black people were due to genetics rather than acknowledging that Black people are at higher risk because they're more likely to be essential workers and not able to stay at home. Not only do Black people not have access to the same level of care as white Americans, but they're not always able to maintain safety precautions like physical distancing, as many are essential workers. issues of race aren't sufficiently explored and addressed in medicine. They're not. Okay? So now, let's talk about myth number 1. And I'm going to go through these myths. I'm just going to read through them. And I want you to understand that knowing about these myths are how we're preparing for the race. Okay? Myth number 1, Black patients present in the same way as white patients. That's a myth. Medical schools don't focus on race. It's implicitly taught that all patients present signs and symptoms in the same way. This isn't always the case. There just isn't enough information on Black patients and their experiences of illnesses. Because who do they study? So when I read a research and I go to, let me just say this. Many medications that are tested, if you read the study, it'll tell you, oh, really? How you gonna test? Because I went to a talk several months ago about high blood pressure and diabetes. And long story short, the new medicine, no, it wasn't diabetes. It was renal failure. It was kidney disease and hypertension. It was a drug that improved kidney function in people who had diabetes. I'm sorry, that's what it was. But guess who the subjects were? They weren't Black people. I said, but guess what? The picture on the poster was of a Black person. I said, you put a Black person on the picture advertising the medication, but the medication wasn't tested on them. I uncovered that myself. And I spoke up, and I'm always in trouble for something. I ain't gonna stop now. Room full of colleagues. I spoke up. I said, wait a minute, something ain't right here. And then afterwards, but I was the only one that spoke up. But afterwards, a lot of other colleagues that looked like me, I'm glad you said something, because I was thinking the same thing. Well, why did I have to be the one to speak up? And why didn't you open your mouth after? Why are you waiting until after the presentation is over to tell me? Oh, you didn't want to look bad. Oh, I get it. Okay, takes people like me. Okay, it's all right. I've been doing it all my life. All right, so Dr. Michael Fite, F-I-T-E, District Medical Director for One Medical in Atlanta, says, and this is quotes, there is a definite and warranted skepticism and mistrust among many Black Americans due to multiple documented instances, such as the Tuskegee syphilis study, the most well-known of many similar incidences of abuse. This means that Black people don't always receive care. Unfortunately, when they do, the care they receive may be riddled with bias. As a consequence of this, there is a dearth of research noted in many areas of medical science as it specifically relates to Black people and multiple disease states. The absence of this research may propagate poor health outcomes and disparities, says Fite. That's right. Example of what I just told you. And this was a drug that recently gained FDA approval. You're marketing it to Black people, by putting their picture. Okay. All right. I'm going to leave that alone. Okay. So, Gunjan, I can't pronounce this doctor's name, but is a pediatric resident physician at Children's Hospital of Eastern Ontario, that's in Canada, says in medical education, we learn primarily on white people, white patients. Right. That's how you learn. So medical students have a poor ding, ding, ding. I just got through saying that. They have a poor understanding of how common illnesses present in Black and indigenous people of color. So the myth is that the same signs and symptoms that the white man may have, the Black man may have. And that's not always the case. This leads to major oversight in diagnosis of some diseases. For example, what does jaundice present? Oh, Lord, here we go. Do y'all remember me telling you, was it last week or the week before, about anemia, and me trying to teach the nurse how to assess whether the Black patient was anemic or not, to look at the mucous membranes in their eyes? Here's an example. What does jaundice present like in people with darker skin? So y'all know what jaundice is, right? Yellow jaundice. Okay. Or how can we detect pallor? Okay, I should have kept reading. Pallor is being pale in those who are Black. London-based medical student Malone Mukwende has taken steps to help remedy this widespread issue with his book, Mind the Gap. Yes, I need to get that and read that. The illustrations in this, I heard about this book. It is a clinical handbook of medical symptoms for Black and brown skin. Okay, that is I gotta get that. And I'm gonna educate you guys on that book, okay? Still on top of the lack of education about symptoms for Black people, there are also far too few doctors of color. Myth number 2, race dictates health outcomes. Medical students aren't given sufficient information about the impact of racism on patients' health outcomes or access to care. Like I told you, that's why I was so upset when I read the apartheid book, because no one ever presented any of that information to me in school. I didn't get to know about those things. Half of the stuff that was in that medical apartheid book, I didn't even know about until recently. They don't teach you that. It's often believed that race and genetics play a stronger role instead of social determinants like medical care and generational wealth. But there are plenty of cons to thinking this way. This idea is being revised slowly in medical theory, but may take decades to trickle down to actual practice. That's right. It takes time. So then you have to be prepared for the race yourself. Prepare them for your race. Know what's out there and educate them. Fight notes that Black people are often seen as monolithic and monocultural. There's no formal educational racism and its impact. Race is talked about broadly in medical school as a social determinants of health, along with education, housing, and poverty, etc. But racism and how that impacts the lives of people that experience it is not addressed. That's why you gravitate toward people that look like you and know where you came from. They understand those cultural things. So you walk in there and tell them you're diabetic and I need you to stop eating concentrated sweets and I need you to You don't even know that at Thanksgiving and Christmas or on every Sunday or every whatever, this is what we eat. How do you help them if you don't know their culture? Okay. Anti-racism training is critical so that physicians are not only made aware of their biases, they don't even realize, like I said, about layers of hate, layers of not hate, but all those layers of dislikes and this, that, and the other that lead to hate. Things that you were taught that you need to be untaught. Because when you bottle all that stuff together, that is where the hate comes in. Anyway. All right. So many times they say that, educating people about race, anti-racism and their biases, and actively advocating for their, Anyway, the page, I think it got cut off. Sorry. But anyway, this is often perceived as something outside of the scope of medicine, and the burden of responsibility falls to Black people. BIPOC. What are they saying? BIPOC. I'm sorry, y'all. Black people. Oh, and Black indigenous people of color. I'm sorry. That's what that is. So basically, it's going to fall on you. And I do know that there is so many equity and inclusion and diversity departments now. And so it's spreading. It's getting there. Trying to teach people and educate people. Okay, it's getting there, and it's going to make a big difference. But people have to want to learn this. Because you can sit there with your arms folded and say, okay, I hear you, but I ain't going to change how I feel. People have to want to change. So the love of God is the only thing, and loving mankind is the only thing that can make a person want to change. I worked with a colleague who told me, and I was so surprised. She told me that her father was a bigot. I said, how could you, as nice as you are, and oh my God, it was almost like, well, you must have resented your dad for being that way, because you are definitely not that way. So, and then there are people who grow up and say, you know what, mom and daddy were wrong. I don't want to be that way, and I'm not going to be that way. And I admire them. And they work toward making things different. Myth number 3, Black patients cannot be trusted. Some healthcare professionals assume that Black people are dishonest about their medical histories. I don't think it's being dishonest. I think it's lack of knowledge and not knowing what that means. So if someone comes at you and says, do you have congestive heart failure? No. Well, I read in your record that you do. You did? You didn't know that diastolic dysfunction put you at risk for heart failure, a sign of an early stage of heart failure. Did you know that? Did you know that renal insufficiency is the same thing as chronic kidney disease that leads to dialysis? If someone came up to you and said you have stage 4 renal insufficiency, what does that mean to you? But if I come up to you and say, stage 4 kidney disease, stage 5, you're on dialysis, would you not understand? It's all in the language and what you say and how you say it. Okay? All right, so it's not that that's a myth. History taken is designed to obtain key clinical information which may consist of current symptoms, personal health, medical history, and pertinent social and family history. But if you don't know your family history, we've talked about that too. Ain't nobody trying to hide something you don't know. This information is critical to the diagnosis and treatment of the patient, but the implicit bias of the interviewer can obstruct the process. There is the untruth that Black patients are less likely to give a true picture of their medical condition and may have ulterior motives when seeking care. You just drug seeking, trying to get some medicine. He also points, this is the same interview with that same doctor, small but significant factors such as colloquialism, excuse me, woo, that was a big word, and other dialects common in Black communities. Small but significant. A lack of awareness or empathy around the way others speak can lead to subtle biases as well as miscommunication. And that is saying it like I said it, a different way. All right, myth number 4. Black patients exaggerate their pain and have higher tolerance for pain. So because of the fact that we have been accused of being able to tolerate pain, so now we're exaggerating our pain. Fight, who is the gentleman, the doctor that is interviewed, recalled a visit to a hospital emergency room when he was a child. I had a pretty bad asthma attack and was unable to breathe. This older white male doctor told me I was hyperventilating and I should just slow down my breathing. He gave me a paper bag as if I was having a panic attack. Oh, wow. Wow. Oh, well. You got to know the myths out there. This experience made him want to be a doctor. He didn't want to have to rely on a healthcare system that he couldn't trust. So he entered the field to improve it. I want to make it better for the next kid like me that goes to the ER scared so they can be taken seriously because it could be a life or death situation. Now I'm going to tell you a personal situation. I was at work one night and I was having abdominal pain and I was hurting bad. Even to the point my mom came up there to the emergency room and sat in the ER with me. I was a nurse there at that hospital, working on the floor when I got sick. They let me lay there, hurting for hours before they did anything. My mama said, if they do you that way and you work here, I said, Ma, that's exactly right. That's exactly right. And that is many of the reasons why that's just one incident. I have been treated so bad so many times, and I am a healthcare provider. Do I trust? Well, I trust myself. I trust myself and let them know that I'm going to let you take care of me, but I've done my research. I walk up in there with a little bit of information and a little bit of knowledge and let them know that don't do me just any old kind of way now. But it took me a while to get there, okay? And that's me, a provider. I'm not even going going to tell you all my little stories. Personal treatment. So I can only imagine what you may go through. So, how pervasive the myth of Black people's high tolerance for pain is in medicine. There was a study, in regards to the myth of Black people having a high tolerance for pain. There's a study in 2016 that was done. In the study, about 50% of the 418 medical students believed at least one myth about race. This included that Black people's nerve endings are less sensitive than white people's. Really? I never read that study. And Black people's skin is thicker. Yeah, and I heard that one now. A Black person's skin is thicker than white people's skin. That's a myth. You want me to show you? I'm going to show you. Look at my wrist right there. My skin is so thin that I got it caught in my car, my seat in my car, and the console. And the black just came off of my skin. Because it's that thin. You see? There's proof that we do not have thicker skin. Now, this factors into the care provided to Black people who experience pain. They often are denied pain medication. Myth number 5, and then I'm going to tell you what I heard on the news today, or was watching on TV this morning. I know I'm over, but we'll be okay. And I turned the TV on, and I walked in the room at the right time to get this. But let me do myth number 5 first. Black patients are medication seeking. One of the most common, these are the things, seriously, you guys, that are really hurting us. One of the most common myths is that Black people come to healthcare facilities in order to get medication. They're seen as addicts, often leading to substandard treatment for pain. Now, I ain't gonna lie to you and say there ain't, but that's in all races. All of them. Okay? Pain is significantly undertreated in Black patients compared to white patients, and that is a fact. That is a fact. Okay? A study of almost 1 million children with an appendicitis. 1 million children with appendicitis in the United States showed that Black children are less likely to receive any pain medication for moderate pain. According to the study, there's also less likely to receive opioids for severe pain. So, because we many times don't, like I told you, we learn not to cut up like someone else may. You think we're not hurting? I don't know. Is that, like I said, is it the grit that we acquired in our DNA? Is it the reason that we may look a certain way and don't express always how we feel because we were told not to or taught not to? Oftentimes, the complaints of pain among Black patients seem to be filtered through a prism of pain medication seeking and histrionics. All right. Oh, here's one about Serena Williams. Having to advocate for herself as she experienced a pulmonary embolism, a blood clot in the lungs during childbirth. And I might need to read about that more. All right. I'm telling you, this is some real stuff. I do suggest that the next time you seek a healthcare provider, that just keep in mind some of these things that I mentioned to you, that we need to stay mindful as we prepare for the race, teaching people about race. And a little birdie just helped me out. I forgot about this one. The Constitution says that black slaves are 3/5 of a person, not all human. Remember, we weren't even really human. Even to the point where sometimes they call us animals. So that perception, how much of that goes into these social determinants of health? So I say to you, I'm educating you about the things that you need to know to better take care of yourself. Keep that in the back of your mind, that your provider may not have enough education about you. And the differences that about you that they need to know to better take care of you. Keep that in mind. Okay? Now, the example that I said I heard on the TV, and then I'm going to let you go. They were talking about swimmers. The lack of black swimmers, like professional Olympiads. And they were interviewing these black people, young people who made it. One guy, I forgot what kind of medal he got in the Olympics. And it reminded me of one of the myths about black people and their bones. He was saying that there was a myth that black people couldn't float because their bones were too dense. Wow. So now we have dense bones. So is that myth about our bones why there may be many black women and men who have osteoporosis or osteopenia and don't know it? Think about it. Are you getting your bone density test done according to your age? Do they suggest it, or do you have to suggest, hey doc, I ain't had my bone density? Well, maybe it's because, black people bones are dense. They're not as at risk of having osteoporosis. You know what I'm saying? What if that myth? But what the swimmer was saying, they were presenting the fact about why black people don't swim. And it's not because we don't want to get our hair wet. So stop telling that lie. We're not comfortable in water. You know why? Way back during the time when everything was so segregated, black people had nowhere to swim. They couldn't take swimming lessons. They're just now. Oh, let me say this. And their parents didn't put them in swimming lessons. It's not that they didn't have the money, but they were scared of water themselves because they never learned how to swim. So I don't know how to swim. You don't need to learn how to swim. Somebody has to break the curse. But that is what I was listening to. And I thought about that. How much of where we are, what we do, don't do, is based on myths. And that is what I wanted to present to you tonight. Are they myths? Or are they objective realities? Are they? But if we're not included in the studies, like the study with the diabetes and the kidney disease, that drug, but you put my picture on the pamphlet. Wow. It's time that we wake up. Wake up. I'm telling you, in preparing for the race, wake up. Educate yourself. They have books out there that you don't even have to read. Guess what? The author will read their book to you. They're called ebooks and Audible books. And you can pay a membership. Anyway, you can subscribe to Audible books. And they will read it to you. It's time to wake up. All right. This is Dr. Anna Shaw Devlin. I thank each and every one of you for listening to me tonight. Preparing for the race. We have no excuse anymore. Research the myths about us, okay? And let's see, they were tortured by waterlogging. The fear of water was magnified. Oh. Waterlogging and fear of water. That's good. Yes. There's so many reasons why we don't do and don't. Isn't that something? I believe, and I have 2 grandsons, that is going to be a priority, is make sure they learn how to swim. Yep, swimming lessons. All right, well, we thank God. We praise God for each and every one of you, my viewers tonight. And we'll see you next week. Because next week will actually be, wait a minute, what's next Tuesday? Huh? Anyway, let me look real quick, because remember I told you that on the 2nd, the 7th, and the 17th, I think it was, we will not have a live broadcast, but we will still broadcast, but it will just be a rerun. Yes, I will see you next Tuesday on the 26th. All right. God bless each and every one. I pray that you have restful night's sleep. Take this information and do your research. Do your research. Prepare for the race. Your race. God bless you. Bye-bye.